Good morning, good afternoon, and good evening, wherever you are tuning in from around the world. I'm Dr. Sanjeev Silva. Welcome to today's Sapien Care Group session. Today, we have a star-studded lineup who will be discussing and debating the evidence for wearing masks, still a surprisingly contentious issue that has been recently politicized and has a non-insignificant minority who argue that the evidence for wearing them is still scanty. So do masks make a real difference? This webinar will examine the evidence robustly, as well as give some historical context as to the attitude to masks during the Spanish influenza pandemic of 1918, which infected 1/3 of the human population, with estimated 50 million deaths around the world. As ever, we have our cherished chairman, Professor Stafford Lightman, Professor of Medicine at Bristol University, who will be moderating the meeting. Guest speakers include historian and author John Barry, speaking from the New Orleans, who wrote the seminal work, The Great Influenza. He will be joined by celebrity Bianca Jagger, the founder, president, and chief executive of the Bianca Jagger Human Rights Foundation. She is a strong, vocal advocate for wearing masks. And we have two elite medics, Professor Peter Barnes, Margaret Turner, Warwick, Professor of Medicine at the National Heart and Lung Institute, and honorary consultant physician at the Royal Brompton Hospital, London. He will be joined by Dr. Peter Tippet MD, speaking from Virginia, who is an emergency physician and the CEO of CareMesh, who is currently famous for his statement on Now This News on wearing masks. Together, they'll be examining the highest quality evidence-based literature. Finally, as usual on the Sapien Care Group, we have a grand musical finale. We have the pleasure of having Benjamin Seifert, baritone, and Kieran Quirk, piano accompanist, who will perform the opera The Masked Ball by Verdi. Rest assured, this webinar will be available on demand on our website, sapiencaregroup.com, for those who want to leave halfway through the live session and want to just review the topics later on. So without further ado, Professor Stafford Lightman.
Well, Sanjeev, thank you very much indeed. This is going to be a really interesting webinar that I've been looking forward to for a long time. In fact, it's been made even more topical by the suggestion from our science chief, Patrick Vallance, who says that we should be hoping to reduce the 2-meter rule to 1 meter. And one of the questions, of course, is whether this is going to be sensible without the use of masks. But I think the first thing we want to do is to look what we can learn from history. And so our first guest is going to be John Barry. Now, John has got a very interesting background. There are clearly many different routes to a successful career, and John has one of the more unusual. You started your career by dropping out of graduate school in history to become a football coach. And then, only then did you start writing books. And you were clearly quite good at this because you won multiple awards for your books and became a New York Times best-selling author. You're the only non-scientist on the US federal government infectious disease board of experts, and were a member of the original team that developed plans for mitigating a pandemic by using non-pharmaceutical interventions. Of particular relevance to today's webinar is your book, The Great Influenza, the story of the deadliest pandemic in history. And today you've very kindly agreed to come and discuss with us masks in 1918. John Barry.
Thanks for that introduction. Thanks for inviting me to participate. I expect this to be quite interesting. I'll give you a brief history. Around 1900, surgeons started using masks to protect patients from droplet infection and coughs and so forth. The first time they were used prophylactically was during an outbreak of pneumonic plague in 1910 in China. A Chinese doctor decided to begin employing them and was pretty successful. In fact, this doctor went on to a very distinguished career in public health in China. And his work was pretty well known. In 1917, unrelated to the influenza pandemic, there was a Chicago hospital that began using masks on patients and medical care personnel for respiratory infections and to protect them, and found that they were pretty successful. They wrote an article in the Journal of the American Medical Association. There was a measles epidemic in many U.S. Army military camps around that time, and military camp not far from there began using it, found it to be, in their view, very successful on patients. Rockefeller Institute for Medical Research, now Rockefeller University, began running a series of very sophisticated tests and trying to figure out whether masks were useful, what kind of materials should go into them, and so forth, how far droplets projected across a room from speaking and coughing. In fact, they infected people with harmless bacteria and placed petri dishes at various distances along the room and measured how far the bacteria would go and cultured them. They ended up coming up with around 6 feet, roughly 2 meters. And masks became, when the pandemic arrived in 1918 later, masks were used very much widespread around the world. And many cities in the United States required them, passed ordinances required them. Although there was pushback even then, even in what was a much more lethal outbreak than what we're experiencing now. As you said earlier, 50 million, possibly as many as 100 million people died, and that was, if you adjust for population, that would equal 220 to 440 million people today. So as I say, much more lethal than what we're facing. Even the worst case projections don't suggest anything like that today. The biggest pushback would come when a city, after issuing closing orders, somewhat similar today, but generally not as extreme, then they reopened, then they would find that they did it too soon and reimposed various restrictions, including mandatory masking. And that was when they got the greatest political pushback, as we are, seeing something akin to that today, although here it's much more politicized. There was no partisan politics involved, at least not in the United States, in those decisions in 1918. Interestingly, despite the widespread use of masks, there are several comprehensive studies after the pandemic. Perhaps the best, there were some in Britain, there were some in every language, but I didn't read them in every language. And there was a particularly good one in the United States, published in 1927, that concluded there was no statistical difference in the general public for mask usage. Although they did conclude that for people, healthcare workers, or in a family setting, if someone was masked, they were convinced that putting a mask on someone who was ill did protect, whereas in a medical setting, it was also useful for healthcare professionals to wear the mask. Based on that evidence, earlier in this pandemic, I was pretty much of the belief that masks on healthy people walking around probably weren't that useful. There have been a lot of observational studies, however, and roughly a decade or so ago, there was, prior to the 2009 pandemic, there was one pretty good controlled study at the University of Michigan on influenza. That concluded that masks cut down, over a period of 6 weeks, influenza-like illness by 43%, although that was not statistically significant. But masks in combination with hand washing cut it down by 75%, which did cross the barrier to statistical significance. In the meantime, and as the other experts on the panel are well aware, I'm sure, there have been multiple observational studies recently. They all come to the same conclusion that masks are useful, but not necessarily that the conclusions are very strongly supported by the evidence. However, I think that cumulative total, since all the studies seem to indicate some benefit, convinced me to probably change my own position, and which is now that, you know, I'm a strong advocate of masks. And I guess that covers my opening statement, if you want to call it that.
Well, thank you very much. That's a very useful and very helpful introduction for us. We'll go into the details of the science behind mask and evidence later when Peter Barnes and Peter Tippet is talking. So I don't really want to go into the science of that now, but I'd like to ask you just one general question, or really a social question. And this came from the cellist Stephen Isilis. And he wanted to know is, after Spanish flu, how did the theatres and concert halls cope? Did they use social distancing? And if so, for how long? Did they use masks? And if so, did the actors, singers, wind and brass players manage? So really, it's, you know, what happened to the development of the arts at that particular time?
Well, pretty much everything was closed. So there was no theater. And of course, back then, you had no TV, you had no internet. Most people didn't have telephones. So cutting down theaters, everything from opera to vaudeville, was a pretty strong move and did get pushback. For people to lose that was very significant. One of the major differences between influenza and coronavirus is the duration. Influenza's incubation period is roughly a third the length of time of coronavirus. You're sick for much shorter period of time with influenza than coronavirus. Influenza today, whether it's seasonal influenza or in 1918, the same thing, it would move through a particular community in roughly 6 to 10 weeks. So it was a shorter duration. After that, probably 2/3 of all the deaths in 1918 occurred in about a 14 or 15 week period in the fall of 1918 through December. But in any particular community, it was shorter than that. So people and the closing orders were generally, almost always went into place too late and generally were open too soon. So the actual closing was much shorter duration than anything that we're facing now in those places where they are rigorous in trying to use public health measures. So by the time they reopened, there was no use of face masks as a general rule. I'm sure there were some places that did do that.
Well, thanks. That's a very helpful way to for us to start this webinar. That's really useful. And our second speaker is Bianca Jagger. I think Bianca probably needs little introduction to most people. She was born in Managua, Nicaragua, studied political science in Paris, and has committed her life to being an activist defending human rights and civil liberties and working for social justice and environmental protection throughout the world. She's campaigned for the most vulnerable, including violence against women and the rights of indigenous people. She's founder, president, and CEO of the Bianca Jagger Human Rights Foundation and has received multiple international awards for human rights, humanitarian, and environmental work. With respect to today's webinar, she runs the Masks for Life campaign and has agreed to join us to address a critical aspect of the masks debate. Not only why masks are critical for fighting COVID-19, but importantly, how can we make them acceptable? Bianca, welcome.
Good evening. It is a pleasure and a privilege to join this distinguished panel of scientists and doctors to address the critical debate about the need to use face masks and separate the science from the myth. I will give you a very short anecdote of why I am so committed to the use of masks. I have a vulnerable upper respiratory system, and therefore I have been using masks in my office for a long time. Whenever I had a flu or somebody had a flu, we did use the mask, but advised by my doctor. For over 3 months, I have been in solitary confinement in London, agonizing, feeling impotent, watching the devastating effect of the coronavirus pandemic, wondering if there was anything I could do to make a difference. I have watched in horror Boris Johnson's shambolic response to COVID-19, which has resulted in a death toll of more than 65,000 people. I will never forget the calls for help from the NHS workers, pleading to be given the critical PPE to protect themselves on the front line. I think that the Sunday Times article, 38 Days When Britain Sleepwalked into Disaster, sums up Boris Johnson's major failures to tackle COVID-19. By the time we reached June, Boris Johnson's government had made a series of deplorable mistakes, which resulted in a death toll of over 41,153 people, according to the government, a number contested by Chris Giles, economics editor for the Financial Times, who has been keeping records in the UK death toll. On the 16th of June, Giles tweeted that his estimate of the total number of excess deaths up to the 15th of June was 65,400. I will enumerate for you the ridiculous and ill-informed reasons given by the UK government for not making wearing a mask compulsory in the UK. 1, they may add to the people's fears and anxiety. 2, the evidence for mask use by anyone who is not infected is near nil. 3, the general public might use face masks for too long, i.e., even if they become soggy. 4, it could threaten supplies for healthcare workers who need them more. 5, it might lead to people abandoning social distancing and hand washing. 6, it might lead to people who are self-isolating, leaving the home, and if they wear a mask. Inequality concern, some might not be able to afford or to be physically able to buy a face mask. 8, people putting a mask on and off might touch the face more. 9, policy implication if people are wearing face masks. And 10, could lead to new crimes such as theft of face masks. How and why I began the campaign is when I saw the horrendous loss of lives in the UK that prompted me to launch the Mask for Lives, calling on the UK government to make masks mandatory and to urge establish and up-and-coming designers to produce masks at an affordable price, and also to encourage people to make their own. It is now more important than ever, in order to protect and save lives, that the public wear masks any time they travel on public transport and when social distancing is impossible. Throughout the coronavirus crisis, we have witnessed the failure of leadership and utter incompetence of Boris Johnson and his minister. One can only wonder why it took Johnson so long to impose the lockdown in the UK. It is clear that when the government claims to be following the science, it is merely a refrain they have been using to mislead the British people. In reality, they were making political decisions. I was inspired by Mask for All, which was an extraordinary documentary that I think many of you have watched. That was originally launched in the Czech Republic by Peter Ludwig and a group of researchers and scientists. The Mask for All movement was so effective that now close to 100% of the country's population wear masks, and the spread of COVID-19 is slowed significantly, as it has throughout the world in all the countries that have as a part of their costume to wear masks. The campaign video featured Minister of Health of the Czech Republic and Aneta Kernova, a young actress, urging everyone to wear a mask and to also produce them. The Bianca Jagger Human Rights Foundation is also organizing a video to convince the UK public to wear masks. But there was, later on in March, I watched an extraordinary documentary that I recommend everybody to watch, the NHK Japan documentary, COVID-19, Fighting a Pandemic. It is informative and it is very powerful. It's produced by Japan, and it is about the range, which already we heard before, the range that droplets and micro droplets from the coronavirus can reach in a confined space, and the length of time droplets and micro droplets can stay in the air. The researchers concluded that the micro droplets can reach 6 meters when someone coughs, sniffs, and even talk loudly. The micro droplets can stay in the air for up to 20 minutes. This research strengthened my conviction that everyone should use a mask. What I want to say is that one of the things that has confused me and has upset me is the whole discussion of the 2 meters and the 1 meter. The truth is that if we're not wearing a mask and we're not wearing a visor, it doesn't matter when you talk about 1 or 2 meters, because as we've seen in this documentary, the reach of the droplets and micro droplets is of 6 meters. So when people are on public transport, when people go to stores, or when they are working in an office that is enclosed, they are in danger. And that's one of the reasons why everybody should be wearing masks. For months now, I have been gathering information on how beneficial it is to wear a mask. Wearing a simple homemade cloth mask can reduce the chances of contracting and spreading the virus significantly, especially when worn with a visor. Over the last 3 months, we saw 50 countries implement strict measures of wearing masks. It is now mandatory to wear masks in public in more than 50 countries across the world. And we have seen as well the effect of how it has reduced the spread of the virus in the number of the death tolls in those countries. Today, Sadiq Khan have urged Boris Johnson to make face masks compulsory in shops. The Mayor of London called for Boris Johnson to make the wearing of face covering compulsory in shops to limit the risk of coronavirus transmission as non-essential retail stores begin to reopen. In a letter to the Prime Minister, Mr. Khan urged the government to follow guidance set by the World Health Organization, which as we know, is very regrettable. The WHO have only recently reversed their policy where they were saying that it was not really recommended to wear a mask. Fortunately, those 50 countries didn't listen to the WHO, but it seems that Boris Johnson was listening to that, not to the test that they keep repeating. I would say that my goal for the campaign of Masks for Life is not only to urge the UK government to make wearing a mask mandatory, but to remove the stigma around wearing masks by making masks for young people that they would like to wear. In order to do this, I'm asking prominent people from the world of art and for the world of science, and I hope that some of my prominent speakers will join me, and as well from the world of sport and all movers and shakers in the country, to say a short message and create a work of art on a mask. So far, I have been contacted with many artists who have agreed to do it, and many galleries who have said that they will do it. And I hope that we will be able to produce this video and that it will have an effect like in the Czech Republic. We need to convince the public in this country that masks can save lives, that it is not something that we have to avoid. We must reverse the brainwashing message that the British government put out for months, telling the people that wearing a mask was counterproductive. and that all we needed was to wash our hands. Yes, we do need to wash our hands, but yes, we need to wear masks, and we need to do it to save ourselves as well as the rest of the people around us. Many thank you.
Thank you very much indeed, Bianca. That's a very, very strong message. And it leads us in extremely well to our next speaker, Peter Barnes, who's going to tell us about the science behind the use of masks. Peter is a Fellow of the Royal Society and Professor of Thoracic Medicine at the National Heart and Lung Institute at Imperial College, London, where he was Head of Respiratory Medicine from 1987 to 2017. He's an international expert on asthma and chronic obstructive airways disease and a previous president of the European Respiratory Society. He's actually the most highly cited respiratory researcher in the world over the last 30 years. Peter, we're looking forward to hearing about the science behind the use of masks. Thank you.
Well, thank you very much, Stafford, and good evening or good day, everyone. COVID-19 is a respiratory illness, a respiratory infection caused by a new form of coronavirus, which is a well-known type of respiratory virus. And most people get infected by inhaling virus particles, which infect the cells that line the nose and the throat. And the virus multiplies in these cells and kills the cells, releasing more virus particles. These particles are then breathed out in droplets as an aerosol from the nose and mouth, especially on coughing, sneezing, shouting, speaking, singing, breathing heavily, but even normal breathing will spread the virus. And this aerosol can then be inhaled by other people who then become infected. Now, simple face coverings catch the droplets that contain the virus and therefore stop them largely from spreading to other people. And almost anything works as a face covering. So an old t-shirt, 3 layers of cloth are better than one. Surgical paper masks work, and these are widely available. And these masks are working by stopping the spread of virus to other people. They're not very good at preventing you inhaling the virus. But the important thing is that these simple face masks reduce virus transmission. And it's been difficult to get good controlled evidence for this, but there are studies showing that there's a marked reduction in virus transmission. But there's quite a lot of very convincing anecdotal evidence that this is effective in reducing transmission. So the Czech Republic that Bianca referred to made the wearing of face masks mandatory, and this was associated with a marked reduction in transmission. Countries of East Asia are commonly using face masks when they have a cold or any respiratory infection. So they have a culture of using these masks. And we know that these countries did far better in this epidemic than countries not used to wearing face masks. A very interesting example is Austria, which recommended the use of face masks in public to the population, and this had little effect on transmission. And they found that not many people were wearing the face masks, but when they made this mandatory, there was a marked reduction in virus transmission in about a week. The UK government has been extremely slow to recommend the use of face masks, and it's been slow in everything, which is why the UK has almost the worst record for handling the COVID pandemic in the world. It's important for everyone to wear masks when in contact with other people. So that's in public transport, shops, the workplace, even in outside spaces where other people are around. But it's important to remember that some people may transmit the virus even when they have no symptoms or before they develop symptoms. So universal use of face masks in public should be mandatory in order to reduce community transmission of the virus. Now, there is another type of face mask, which are so-called medical masks, which include N95 and FFP2 masks. And these are made of fabric that filter out virus particles. So they protect people against being infected by inhaling virus aerosol. And these are masks that should probably be mandatory for people who are vulnerable to the serious effects of this infection. So this includes the elderly, people with immune suppression, people with heart disease, diabetes, etc. And also some people are exposed to higher levels of virus, doctors and healthcare workers, and the use of this mask should be mandatory for them. Now, the last point I want to make is that this virus is not going to go away. We have to live with it. It will take some time to develop a vaccine, and even now we don't know if a vaccine will be effective. So we have to live with the virus and deal with it. And I think that the mandatory use of face masks and face coverings in public places is a very important strategy for us to adopt. And we really need to change our culture so that this becomes a normal way of living in the future if we're going to significantly stop the progression of this terrible infection. So thank you very much, Stafford.
Well, thank you very much, Peter. So that was a very direct and very clear message to all of us. And we're going to go on now to Peter Tippet in the same subject. Peter's a physician scientist, a business leader and entrepreneur with a special interest in health information technology. He's worked on synthetic antibodies, computer modeling and commercial antivirus products. He's the founder and CEO of CareMesh, that launched the first national platform for hospitals, practices, and public health agencies to securely share messages, patient records, and lab test results. Peter, please continue our conversation on the scientific basis of the use of masks.
Well, yes, thank you, Stafford and John and Peter and everybody. This is a very important topic, and it's great to be part of this discussion. I find it amazing that we even have to have a discussion. But, you know, I think there's two things that are true about humans that are just not natural, no matter how well trained. One is that we're not particularly good at thinking in exponential math. This is the reason that John said that almost all the shutdowns were late in the 1918s and 19s and 20s, and they were late here too. Because you see, you know, if you were a farmer and you saw a mouse in your grain, you'd know that there are hundreds of mice in your grain, even though you only saw one. Or if you live in a big city and you see a cockroach, you know there's hundreds of cockroaches, even though you only see one, because you know how this works. But we don't know how viruses propagate. And if a city has 10 known cases, that really means that we're in deep trouble in 2, 3, 5 weeks from now. Of course, the epidemiologists understand how exponential growth works, but it's not a natural concept in the rest of our lives. And so we are often taken by surprise there. With regard to masks, I think the biggest conceptual problem is that people prefer to think in binary terms. Something either works or it doesn't work. And I'll just submit that nothing we do to protect us against anything is binary. Just nothing, right? So let's take automobiles, for example. We used to kill 50,000 people in America a year in automobiles when we had 10-fold fewer automobiles than we do now. And somebody said, why don't we strap a nylon belt around our waist and that might save some lives. Well, it turns out that the 2-point seat belt, just the waist belt, reduced the likelihood of dying in between those who wore them and those who didn't by 45%, almost in half. We added a third 3-point restraint and made them a little more comfortable with inertial reels, and we wound up with about 50% reduction of death when you wore a 3-point restraint. I have some friends who are aerobatic pilots and military pilots, and they have 5-point restraints, both shoulders, both hips, and one down the middle. And they're also 4-inch wide belts. They're a little bit better. So, we can get seat belts to be better and better, but just because a 5-point 4-inch seat belt is better than a 2-point 3-inch seat belt doesn't mean everybody needs a giant, fancy, complicated seatbelt. Does it work better? Yes, but doesn't mean that wearing a lesser one is no good. This is the sort of complaint that we all talk with each other about is, oh my God, this is an N95 mask. And the 95 means that the labs have proven that it stops 95% of particles of a certain size. That's great. That means that it doesn't stop 5% of particles of that size, right? That's what it means. These other masks, whether it's a homemade cloth mask, like this thing, or whether it's just a piece of cloth and a bandana that you wrap around your face, will stop a lot of things. But we kind of get the difference between what is science and what is not gets confused in our discussion as well. So there's lots of studies where people take particles the size of individual viruses and prove that under certain pressure and situations they can blow 80% of them through one layer of a bandana cloth, but only 70%, but only 20% of them through a certified mask, and therefore these things are useless. This is the difference between science and a test. I mean, obviously, for the purpose, if what you were trying to stop was little particles blown through with a particle gun, then that's exactly right. But the studies we need to kind of get our heads around are less about the physical properties of how things work, but more about what actually happens in the real world when real things really happen to real populations of people. And the studies and experience that Peter Barnes mentioned are excellent examples where entire populations are radically better with masks than without. There's other studies. I've got a Lancet article in my hand here that was written on June 1st. So if you just look for Lancet June 1st and masks, it's called Physical Distancing, Face Masks, and Eye Protection to Prevent the beta coronaviruses. This is a summary study, it's so-called a meta-study of 43 other studies. Each study individually were well-done scientific studies that go all the way back to SARS and MERS and the viruses that were very similar to the current coronavirus in the same family. And this article shows that beyond any doubt, with multiple studies across multiple continents, with statistical significance and every kind of test you could imagine scientifically, that in real hospital workers exposed to real people with real viruses of these various sorts, that wearing a mask works. The simple masks, the so-called surgical masks, the kind that are made of cloth, reduce the risk for clinical workers by about 6-fold. That is a 6-fold reduction of risk if you wear the mask versus not wearing the risk. It's called relative risk. Remember, your seatbelt is only 2-fold relative risk. So even a crummy mask is several-fold better than the seatbelt in your car is at stopping you from dying. The better masks for the historical viruses, the SARS and MERS viruses, were somewhere in the vicinity of 20-fold risk reduction for medical workers versus these cloth masks, so-called surgical masks, which were on the order of 5- or 6-fold risk reduction. Oddly and interestingly, the coronavirus that we're dealing with right now isn't the same as the SARS or the MERS. It's a little different. We've talked about here. And I don't know whether it's because the virus is different or what, but of the 44 cases of comparative studies between different sizes and kinds of masks among medical settings, there were 3 that were done with this particular virus this particular year. And for all 3 of those studies, 100% of all studies done well in medical workers being protected or not against the COVID-2 current virus, the risk reduction of any mask, whether it's a surgical one or a super duper one, was over 25-fold risk reduction. Huge risk reduction at protecting medical workers from becoming infected. Now, this study was about protecting people from being infected themselves. And it is true that the poor masks, the air could potentially flow around the edges and you might get some of these particles. It's useful to know that there are roughly 3 different ways you might get infected by this virus. The one is a so-called touch a mechanism where you shake someone's hand and then rub your nose or face. That's very common for most respiratory viruses as a vehicle. It seems to be a lower, it certainly works for this virus, but it seems to be not the #1 method of getting this virus. And that may be partly because we all quit shaking hands and quit hugging each other. And that does a pretty good job of not getting the virus on your hands, at least first person. The second thing, as Dr. Barnes just mentioned, is the sort of sneeze, the big particles. Big particles in a sneeze. The Mythbusters showed some sneezes, world record Olympian sneezes could go maybe 30 feet. And if you happen to be in that in the direct path of that, you might get splattered by a sneeze. Those particles are relatively big and they move as you would expect a particle would move. And then there's what we call aerosolized particles or viral fog. This is where the virus is in something so small you can't see it. But it's still in a little tiny droplet of water. And it's that little drop of water that keeps those 100,000 or a million particles alive. And so it's not a single virus of the tiny, tiny size of a single virus. It's a virus with 1,000 of its brethren in a tiny droplet of water. And stopping the droplet is the key, not stopping the individual viral particle. By the time a viral particle becomes an individual viral particle without water, it tends to die very quickly and become non-infectious. So it's less likely that we'll be infected by the tiny, 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 tiny thing than by the viral fog or the droplets. So all I'm getting at is masks do indeed work to protect people from getting infected. And the big debate that drives me berserk is this notion of not whether to wear one or not to wear one, but why to wear one. Of course, it protects other people, but people are kind of people are, we tend to be interested in our own welfare. And if we can convince people that if you want to be safe, you're better off wearing a mask, that's really a powerful argument. And then the final thing is that people, I had a neighbor who caught me in the garden behind his yard. We were, 4 or 5 meters apart having a discussion. And he told me that when he takes his dog for a walk in the countryside and never sees a person, and he get back home, his wife wanted him to take off all his clothes, put them in the laundry, take a shower, and then he'd be safe. He's told me he had to stop flossing his teeth because touching his mouth was dangerous. And that led me to write an article about not whether to use masks or not, but when to use these things. If we tell people they have to wash their hands all the time or don't touch their face or wear a mask, it's just as important to say when to wear these things and when to do them as why to do them. So I wrote a little article about that. I wrote it a couple of months ago called Saving Your Health One Mask at a Time. If you Google my name, Tippet, and something about masks, you'll find it. It got read by, it's 6 pages long. It got read by 2 million people. Unbelievable. I never would have expected that. But it really just said, if you're at home in the safety of your house, you're in a safe place. You don't wear a mask. You can rub your face and rub your nose all you want. Floss your teeth, go for it. If you're taking the dog for a walk and you're never near another human being, that's safe. You're outdoors, no problem. When you want to wear a mask is when you're in a danger zone, and that's when you're around other people, especially indoors. I'll quit at that.
Thank you very much indeed. We're getting lots of questions in at the moment, and that's incredibly nice. I'd like to start with one that's just come in from Fiona Agger. In fact, she sent two related questions. One's probably a quick answer. Is it true that surgical masks are only effective for 15 minutes? If so, where does that leave us? And likewise, the homemade version. I think you can answer that quite quickly. But a second one is there an argument, given the severity of the disease, that 95 masks are made available to people on income support? Peter, let's start with you.
You got two Peters, but
sorry, Peter Barnes. Peter, why did?
Okay, well, surgical masks will continue to stop you spreading the virus particles, so those can be used for a long time. There's a lot of mystique about how you deal with masks. People sort of treat them as dangerous objects, but you know, they can be washed in the normal way in the normal washing machine, and it will make them sterilized. So you know, it's something that we really just need to get used to doing.
Can I make one point about the N95s? I walk down the street and I see a lot of people who have N95s. They put it in their dashboard for the sun to kill virus. And that will do that. But the N95s also have an electrostatic charge, which is very important filtering the virus. And sun will destroy the electrostatic charge. So if you do have an N95, keep it out of the sun. Just a point of usage.
Almost any amount of heat will kill these viruses. You know, people talk about how long the virus lives on a cardboard or a mask or whatever. They die on a half-life, just like nuclear radiation. And 30 or 40 degrees Celsius for a half an hour or an hour is plenty to kill off essentially everything. And that dashboard of your car with a little sun protection or not will kill all the viruses very quickly just because it's hot. You don't need the UV radiation, most of which won't make it through your windshield anyway.
But I have a question about what you just said, Peter, because if that was the case, the spread of the coronavirus in countries such as Brazil or Nicaragua or all these tropical countries where the heat is unbearable, why is it that we're seeing such a spread of the virus in those countries?
Yeah, we're talking about the difference between how the virus propagates between people, which, as we've all been discussing, happens in close proximity to other people. Either you touch their hand or their face with your hand or your face, or you breathe what they're breathing out, and or what they sneeze out. That's a very direct thing. It doesn't matter whether it's 100 degrees or 130 degrees. If you get it straight in the face, at, a quarter second after it's produced, you're going to get infected. And so the heat of the day is not much of a protector when you're in close. What I was talking about was if you're trying to, quote, sterilize your mask, or what, is it okay to use it again? The people who are asking these questions aren't medical workers. They're folks who need to go to the store for an hour. And they ought to wear the mask for the hour they're in the store and take it off when they get back home. And, and by tomorrow it'll all be fine again. And if they want to wash it, they can do that in the sink or throw it in the washing machine, and everything is good again.
The other question was about the availability of N95s, and at the moment they're quite difficult to get because everyone's trying to get them. But they're not expensive. I mean, they shouldn't be expensive. It's just made out of some material, and they should be widely available. The government should subsidize their manufacture and make them available to all vulnerable people and healthcare workers, people who work in care homes, etc. So they need to be very widely and much more widely available than they are today.
Peter, can I ask you from this, because they follow up on this, because John Warren has sent in a question and says that although we have a national health funding scheme, there are 211 clinical commissioner groups in England alone, and in the US it's going to be much worse. What's the best way to ensure an adequate supply of N95 masks on a national basis?
In the US, it's the use of the Defense Production Act, I would say. Which, our president. I guess the worst in the world is in Brazil. I think UK and the United States are running neck and neck for the second worst leadership in the world, unfortunately. In the US, it'd be relatively easy to do if the White House wanted to take the leadership and get it done.
But Peter Barnes, in terms of all the clinical commissioner groups in England, do you think this is possible? Is there some way of doing it?
If there's a directive from the Department of Health, then they need to be mandated to do it. I mean, they are just the suppliers and distributors. If they're mandated to supply them, then they should do it.
So are you basically saying that throughout the whole of the pandemic we've had here, there has been no mandate for people to produce lots of masks?
Well, not that I'm aware of. You mean manufacturers?
Yes.
People have offered to do it, but I don't believe that that's been coordinated.
It's interesting because we've got a question here from Alexander Sefalian, who has made a graphene-based environmentally friendly mask. And he says he's gone to the UK government to ask. And basically they weren't interested. And it seems that we currently rely on China and India for practically all of our masks. Is it really too difficult and expensive to build factories to make masks in the UK?
No, well, I agree that this is something that should be sorted out urgently now.
Yeah.
But apparently, according to a Panorama program, the UK government sold 21 million face masks so that they were not available.
They sold them to another country?
Yeah, presumably. So they were not available for a pandemic.
You know, I do want to point out, and I'll say it again, we shouldn't avoid the good because we want the better, right? It is these cloth masks, whether they're your old T-shirt or a bandana or something your mother, grandmother, sister, your brother made, work great. They don't need to be expensive. They work great. If you can get a 5-fold reduction of risk, which is what the science says, that's 3 times better than the best seatbelt in your car for the equivalent risk. If you want to get a 10 or 20-fold reduction of risk, that's better. But why wait? Everybody already has an old shirt that doesn't fit anymore, or that's a little bit ragged. Let's get on with it. We just need to get comfortable wearing masks. Any kind.
Peter, can I ask you a related question to this? And this was from Sonia York. If I take the mask off and put it in my coat pocket whilst I'm still out and then go home, when I take it out, can I transfer COVID to my hands or coat or handbag?
The answer is yes, you can, but that's called fomite transmission, and it's found to have been quite low as a risk factor in this last 4 or 5 months. Touching something that has the virus and then getting it yourself. If you read my little Saving Your Health paper, I suggest people get in a routine. When they get home, they take off their mask, put it wherever they're going to put it, wash their hands, and give up on worrying about these things. Right? Whenever you go to your safe place, wash your hands, put your mask away, wash your hands, and live your life. Right? When you go back into the danger zone, take your mask with you. I recommend people take a pumper of some lotion, cleaning disinfectant lotion for their automobile. So when they come back out of the store, they can consider their car their safe place. They get in the car, wash your hands, take your mask off, you're safe. Your mask will take care of itself. Put it in the water. But
or wash your mask, because you can wash your mask. I think that one of the things that we have forgotten is that soap and water is very effective to getting rid of the virus. People think that they can only use this disinfectant of all kind, but really all we need is soap and water, and we need to wash our mask. So it's really so that we wash one and then we dry it and then we use the other one. But I, as an environmentalist, I would like to say something really important that has been bothering me is the fact that we use gloves plastic gloves, we're throwing them away. We use disposable masks, we're throwing them away. And we are, and this is affecting the oceans as well. We can wash all plastic gloves. We can wash all masks, and we should not be throwing away disposable masks all over the place like I seen at the moment everywhere.
And by the way, masks are wildly better than gloves. If you had to do one or the other, masks are the thing.
Really?
Gloves only work for very short periods of time because, you know, really what you're trying to do is keep from moving the virus from one person to another. In hospitals and work where you're doing this, that makes sense. But wearing the same pair of gloves all day long just means you get the gloves infected and they wind up moving the virus just like your hands would have.
Unless you wash your hands with the gloves.
Exactly.
That's another practical question, which is, can you keep from Sajid Kumar, can you keep N95 and put them in an oven to sterilize them?
I do.
Yeah, so do I. Okay, there's an anonymous question. I would like to ask a question of Bianca, which says, how as an older person did she find the whole lockdown experience? And once it's lifted, Bianca, will you feel confident to venture out in society with a mask on?
Well, I have really been for 3 months in quarantine. And I will say that whenever I went out, which was because of the NHS and the instructions that I received, that I should have stayed in until the end of June, by the way. So I went rarely to the park, and I wore a mask, a visor, gloves, and cover my hair. Always thinking about that video of the 6 meters that the droplets and the micro droplets would reach. So how do I feel? I am quite scared to go out into the world. The reason why I am is because I see that people believe that the virus is no longer a threat. The virus is still a real threat. And the fact that the majority of the people are not wearing a mask. If only people will understand how important masks are to save our lives and to save the lives of people around us, then it will be very different. But until then, I'm very scared to really go out in the world without a mask, without a visor, without gloves, and without covering my hair.
Can I follow on from that? Because that's really interesting. We've got a question from Lynn Russell, who says, how do you think we can get young people, 16 to 25, to accept wearing masks when showing their faces is so important at that age? And certainly my experiences of walking around is there are a lot of young people who are really greeting themselves being around. I mean, they're the people who aren't wearing masks, and they're also the people who aren't really social distancing. So how can we do that? I don't know who would like to answer that.
I would like to say something. For example, you have great artists at the moment who are designing masks. I am asking great artists to be part of this video, but you have great masks by Ai Weiwei. You have lots of young designers. You have well-known designers who are doing beautiful masks. I mean, I've been sent masks to wear in the house. We need to make them attractive. We need for them to think that wearing a mask from a great artist at an affordable price is something that they would like to have, you know, an object, a desirable object. That's what we need to create.
I agree with that. But the other thing is that your boss can say, if you don't wear a mask, you can't come to work. It's pretty straightforward, right?
Of course. I mean, yes, I agree with you, absolutely.
Yeah. Or if you want to come into this store and buy something, you must wear a mask to come in.
It could be made mandatory by the government, as it was in the Czech Republic and Austria, and then people wear them. You get fined if you don't wear it. It's quite simple. This is to save lives.
I agree.
As it is in 50 countries around the world.
Absolutely.
You know?
Well, I have one quick question. In the United States, it's been politicized. In Brazil, it's been politicized. So supporters of the president in both countries don't do it. The UK, I don't get the sense that it's politicized. It's just a question of competence or incompetence, I should say. Is that correct?
It is total incompetence of Boris Johnson and his government, and the fact that he has never understood the importance of masks. To that extent, it is politicized. It is shambolic policies of this government.
We've also got a few questions about children. So Sonia Abraham writes, should children at school wear masks? And I've also got a question from Raisa Kohli, a secondary school teacher, on what's the panel's opinion on the advice on wearing face masks or covering in a secondary school classroom with up to 16 people, the reduced maximum size of classes in the UK, for 2 hours, even when windows and doors are left open. Peter,
I would think that children over 11 should be wearing masks in school, and all teachers should be wearing masks. I think it's difficult for young kids to keep masks on, but I think they should be worn in schools.
If you look at the, again, this risk question, we don't rely on seatbelts as the only thing that keeps us from dying in a car. We also have airbags, which reduce risk by another 30%. And we have rules and laws and training and drunk driving procedures and on and on and on. Each of those individually is only 5 or 10 or 18% effective, but together they reduce the risk dramatically. So it isn't any one thing that's going to protect you, although if you had to pick one, it's masks, and the other that's about equally strong is this distance. Those are roughly, both, you could imagine them different situations being powerful, but together they are very powerful. And the way we solve problems of risk is we mix different countermeasures together, and where one of them might fail, the other one picks up, and you wind up reducing the risk to you and to the society around you.
Yeah, I would say I think distancing is, in my way of thinking, more important than, I think that's the single most important. And incidentally, Bianca, the viral load is a factor, of course, in how likely you are to be infected. And, a cough or sneeze can send virus an extended period, distance, but the load gets less the further apart you are. So even though those extreme distances, maybe 30 feet, do carry some virus, but it would be a pretty small load and low risk.
There's a lot of discussion in the UK at the moment about whether the distance should be reduced from 2 meters to 1 meter to allow economic recovery. And I think masks are going to be an important part of that discussion. So I would think that 1 meter on a mask might be as good as 2 meters, but allows people to do more.
So we've got some questions on two related things. One is a lot of people just don't wear the masks in the right way. So this is from Amy Solomon. Why do people not understand the correct way to wear the masks and only cover their mouths?
It's uncomfortable. People, one thing I think we can get to is better and better masks, ones that are more and more comfortable, ones that restrict less and less air. One of the reasons I'm a fan of cloth masks is because most people can fashion a cloth mask that is more comfortable than something they might buy. In my mind, wearing something over your nose and mouth of a lesser quality is much better than wearing a stronger thing that doesn't cover half of your orifices. Right?
Well, I'm glad you said that, because one of the things that sort of has really struck me is that the governments are spending massive amounts of money on all sorts of different things, but I just haven't seen people investing in improving mask design. Is there much work on masks? I just can't believe that there aren't better, more comfortable potential masks that people could wear comfortably, easily, be able to talk and without fogging and all the other problems. What are people not doing that research?
Yeah,
I imagine they are now, because we're seeing how important masks are. And as Peter said, there's a question of getting something that people are comfortable with wearing. So it's an important issue.
Yeah, as we recognize that this is going to be with us indefinitely, even if there is the vaccine, it's unlikely it's going to be 100% effective like a measles vaccine. the virus is going to be around essentially forever, I think, and masks may become more common usage over an extended period of time. So there's a market, a potential market for there.
Can I ask, there's a question from Nana Oze, who'd like to know what's the role of air conditioning in risk transmission? I mean, quite a lot of people are worried about this. They go into an air-conditioned building and think maybe somebody in the next door room's got COVID. Am I going to get it?
I wrote a paper that I didn't publish on that. Heating clearly kills it on the way by. You know, when the air returns through the furnace and comes back out, it doesn't take a lot of heat to kill the coronavirus. And essentially all furnaces are probably hot enough to reduce the dose by 100-fold or more. Air conditioning probably doesn't reduce that risk much. But you do have distance. And so of the people who got infected, there's a couple of other interesting studies. Chinese restaurant, half a dozen people got infected, and even ones behind the people who were the principal case got infected, even though the air was going away from them. So that presumably circulated around and came back and got them. So there is some anecdotal evidence that the load can go through an air conditioner and come back. It would have to be a pretty short trip, and the load would have to be pretty high for a pretty long period of time. So the key to getting infected is high loads for long periods of time. Essentially all cases where big events happen in closed buildings with high loads for a long period of time. Businesses where people are among their peers in closed rooms, even big closed rooms, for 8 or 9 hours. Churches where people are singing for 2 or 3 hours, even though they're staying 6 feet apart, they still can get it because the entire room becomes filled.
What about the plane? In the planes?
Airplanes are the air that gets in the airplane goes through the engine first and gets up to several thousand degrees before it gets in the airplane. And then it goes through very, very high HEPA filters and only comes back to the zone where it started from. So airplanes are relatively safe compared to other closed places.
So how do you explain that very often some people, such as me, we get sick after we've been in the plane, and we've always been told about the reduction of oxygen that they have now in the planes because they want to economize and the way it affects us. You don't think that could be?
Airplanes are very dry places, and that's one of the reasons people feel lousy when they get off of airplanes. It's less about the of course, if the person next to you's got a 4-year-old kid sneezing and drooling in your face, you're out of luck, right?
There is a case of a person who was infected with COVID who went on a long-haul flight and was wearing a face mask and was found to be positive for the virus when he arrived. No one on the flight was infected because this man wore a face mask throughout the whole journey. So I think that's quite an instructive example of being in an enclosed space. As long as you wear a face mask, it markedly reduces the risk, even when people are known to be transmitting the virus in their breath.
Very interesting.
I think
there's also a recent account in the United States of 2 hairdressers in a salon on 140 clients, and everyone was wearing a mask and there was no transmission. So again, anecdotal but pretty powerful argument for a mask.
I think that's a very good, but I mean, I've got a whole list of questions here. We could go on for another hour, but I don't think we can do that. But I think that's a good place to end. And I'd really like to thank our panelists for a very spirited and very informative discussion. I think it's been a really excellent webinar. And I'd like to thank you all very, very much indeed. And Nick Morris is going to end the session.
So, Jonathan, if you could bring me to the screen, because I can't see myself at the moment.
You're wrong.
Am I on?
Yes.
Oh, I just can't see myself. Okay. Well, listen, I'd like to thank everybody for taking part in today's webinar. You know, everybody comes from so many different worlds, from different places, from different expertises, but the passion we've heard about today's webinar is amazing. And while this webinar has been going on, Sanjeev and I have been getting a series of text messages. And, you know, I've got politicians who just texted me saying, we need to take this to Sage. Sage needs to watch this video. Well, let's hope they can watch this video. I feel very privileged to have been able to watch all of you today. I'd like to leave you with, first of all, the poster of our next webinar. If we could put the poster up, please, Aya. So we're very privileged to have with us next week Jerome Kim and David Salisbury, two of the world's great vaccinologists. And this is the question that Stafford posed them: COVID vaccines, a reality check. So if you're free next Thursday evening at this time, please join us for this webinar. I don't know about you, but I learned so much today listening to everybody who brought so many different perspectives along. And I'm always very grateful to Stafford as our very moderate moderator. Now, on a completely different note, we thought we'd leave you with something rather special. So Ben Seifert, who appeared rather disheveledly earlier on, is my nephew. He's a barrister and opera singer, and he's going to sing From the Masked Ball by Verdi with Kieran Quirk, who is his friend and was at university with him. And I'd like to thank Aya for doing the animation. I'd like to thank Lynn for her fabulous facial masquerade masks that she provided for the poster for this event, which was unbelievable. And many of you might not have realized, but the eyes behind the masked individuals were the eyes of the speakers today. So on that note, till we meet again, which is hopefully next week, I'd like to thank everybody who's taken part in the webinar. I'd also like to thank the backroom team of Liz and Jonathan, because we can't do anything without them. Sanjeev and I are very grateful for your attendance today. And so I'd like to leave you with my nephew, Benjamin Seifert, and his friend, Kieran Quirk, and Verdi.
Chiavi quell'anima, la delizia dell'anima mia, che m'affidi ed un tratto esse gravide, l'universo avveleni per me, avveleni per me. Traditor che compensa in tal guisa dell'amico tuo primo, dell'amico tuo primo la fe. Guardelia si bella, si candida, sul mio seno brillava amor. Quando Adelia sul mio seno brillava d'amor, brillava d'amor. Finì non siede che l'odio, non siede che l'odio alla morte nel vero vocor. Dolcezza d'amore, oh speranza d'amor, d'amor, d'amor.